A lot of men may not know that they have that condition, but they come in complaining of a red nose, which ends up being more prevalent with certain activities or ingestion of certain foods or alcohol. And so a lot of men do complain about the red nose, which is rosacea, which is more medical. We end up using oftentimes a laser, which ends up being a much better type of treatment for men because they can see a good reaction after just a single treatment. Typically, you need at least a couple, but it's better and easier for them than applying topical agents and or taking an oral medication. So this is something that we have a lot of people coming in for that, and they're very satisfied with treatment.
The approach in the male patient should be much different in that the male face is very different. Not only the structure, the bony structure, and the muscular structure, but as well as the aging goals of the male patient. So, for example, rather than augmenting the lips that is commonly done in women, in the male face, often we will apply filler along the jawline or above the brow. These are masculine features of the face that are often not augmented and are not considered to be treated in a lot of our patients. So, there's not a one way to treat all our patients when using botulinum toxin and filler. In fact, the female and male patients should be treated very differently to highlight the masculine and feminine features.
Men's skin is definitely thicker, and so oftentimes, while we may use the same energies, we may apply additional passes of the Fraxel laser in particular areas, such as the cheeks or the jawline, where if somebody has a lot of large pores or atrophic scars, they would require a little bit more energy being placed in those regions. So in general, we treat them similar to women, but they have to typically, because of their thicker skin, additional passes may be needed, and we treat them on a case-by-case basis. Some men have thicker skin than others, but in general, they have thicker skin than women.